Hi guys, my name is Nora and I am a senior in nursing school right now. I go to school in Illinois and I'm not sure if I'm allowed to say my school's name and all of that information, so I'm just gonna leave that out. But just know I'm a nursing student and yes, I am a senior. Thank you, Lord. I just wanted to make a video for those who are incoming nursing students in my school. Your junior year of nursing school is when you are in nursing classes, like you're in your pharm, your health assessment, your fundamentals, all of that sort, and then you get to experience clinical for the first time. At my school, we are given the opportunity to head to clinical in person. So I thought that was pretty neat, and I just wanted to create a video for those who are also heading to clinical for the first time, and you don't know what to expect and what to take. I feel like a lot of the videos that I saw on YouTube were their personal experience, and I just never knew what to take. Like, should I take an extra pair of clothes? Should I take all these scrunchies just in case my scrunchie breaks? Should I take like 10 different pens? Like, you don't know. You don't have videos like that on YouTube. Well, at least I didn't find any like that. So I just wanted to create a video for incoming students, or those of you who, are thinking about attending nursing school, and just want to get a sneak peek of what it's like, and what to take. So I created this video of what I take to my clinical. My junior year, I had clinical for what classes? My first semester, junior year, fall semester, I was in one clinical, and I think it was for fundamentals. Yes, it was for fundamentals, nursing fundamentals. I was in the city, I was in Chicago for my clinical, and then my junior year spring semester, I was in clinical for my, what was it? Nursing mental health. Yeah. Nursing behavioral health or nursing mental health, something of that sort. I was in clinical for that, and then I was in clinical for my med surge. For that, I was somewhere in the suburbs in Illinois, and then incoming fall semester senior year, I will be in two clinicals. I will be at an OB clinical site and a critical care clinical. Those are both located in Chicago, and I'm very excited. I'm getting all my stuff done just to make sure that I get the green light to attend clinical and, to get that learning experience. I'm still, preparing and getting everything ready, but my clinical bag still has some stuff that I took the previous semesters. It has stuff that is in there that I took to previous semesters. So I just thought it would be nice to share that with everybody. And again, thank you for watching this video. Make sure that you give it a thumbs up and that you subscribe to my channel. I would like to hear from the audience to find out what videos would you like to see. Now that I'm a senior, I've kind of been through it. I know what to expect, but like what it's like. I would like to help those future nursing students or nursing students, future nurses. And if you have any tips for me or any advice for clinical in this pandemic, go ahead and just leave a comment. I would really appreciate it. So yeah, let's just dive into this video. So this is my clinical bag. I know it's really big, but I carry a lot of stuff. Some schools or some hospitals might suggest for you to carry something smaller, just because there's limited room inside of the locker room or wherever it is that you are storing your belongings. Sometimes it's not in the nurse's locker room and they just take you to this empty room where they store things. So you just have to try to fit everything to the best of your ability. So this is a cute purse that I got, or this cute bag that I got from Vera Bradley. I got it specifically for clinicals because I knew I was gonna be carrying a lot of stuff. So the first thing that I'm gonna talk about is my secondhand watch. I got this off of Amazon. I thought this was really cute. You're gonna need one for nursing school when you take somebody's respiratory rate. You have to be looking at the watch. And then, you know, it's just something that you should have on you regardless, because you should be able to keep track of time at your clinical. You shouldn't have your phone on you, and you shouldn't have your any type of a watch that's really expensive, because, you know, things could get on it like urine, poop, vomiting, anything. You don't want to ruin something that expensive and something so valuable, you know. So just go ahead and get a cheap secondhand watch. So inside my purse or bag, I have a clipboard that I also ordered off of Amazon. This is super huge. Compare it with my head. It's really big. I got this off of Amazon and I love the color. Orange is my favorite color. You're gonna need either a little small pocket notebook or something for you to be able to write on, because when you are heading to clinicals and you're in there, when you're shadowing the nurse, they might assign you to take your patient's vitals. You need to be able to organize it in a way, in some type of a format that works for you, to be able to keep track of your patient's vitals. Sometimes they just require you to report the vitals to the CNA who's on the floor or the unit for that shift. And sometimes you are in charge of charting that. It's different for every hospital. Every hospital has different policies, but I always made sure I had like 5 blank sheets of paper. Right now I have some like old MedCalc that I was studying for school. But yeah, you want to carry paper on there. This is how it looks like without the paper. And in the back, it's really nice because it has like some tips, some reminders. Like it has labs on there. It has blood gas results. It has ABGs, vital signs, normal vital signs, EKG, weight, temperature, a bunch of stuff that's just going to be really helpful for you in clinicals. So if you'd like, I could post this onto the description, like the link of where I got it from on Amazon. And then inside my clipboard, I have a dry erase marker. Again, if you are in charge of vitals and you're like shadowing your nurse, she might be like, okay, go ahead and write on the board, write my name, write your name, and write today's date, write if they're NPO, write if they have like any procedures today that they need to be reminded of. You know how like patients have that little dry erase board in their room. So I think it's always handy to carry one of these. You could just get this like at a dollar store or like Walgreens or something, but I have a dry erase board that I used to study, so I always carry one of these when I go to clinical. A pencil. With vitals, I like to take my vitals with my pencil, because what if the blood pressure that you took, it just doesn't make sense and you feel like you need to retake it, but you already wrote it down? You just easily erase it and then just go ahead and write the one that you feel like is best to chart. And then I have a pen light. So my friend got me this for my birthday for school. It's a really nice pen light. You're gonna need this. I suggest that, especially for incoming nursing students, to really practice your assessment, like your neuro assessment, your head to toe. Really start getting used to that, because you're going to need to know that as a nurse. And this pen light has like I guess, the measurement for like the pupils. If you were to chart it, like it gives you like a measurement, like something to go based off of. I like it. I thought that was pretty cool. And then, let's see where I got these for my birthday as well. I got these cool, colorful pens, like with all those options. This is really nice. This is nice to like, it's really good for writing down notes and charting on a piece of paper. Obviously you're gonna chart it like through the system that your hospital has, but when you are in charge of 8 different patients and you're constantly monitoring all of them and, you know, following your nurse and making sure that everything gets done, I like to use different colors for different things. So for example, if I need to remember that the person's glucose needs to be checked at 11 a.m., I'm gonna write that in a color that I haven't used to just remind me when I get a chance to look at my clipboard, like, don't forget at 11 a.m. you're taking that person's AccuCheck. You're taking that person's glucose levels. And then if you only get like 4 patients, I guess there's 4 colors on here. Every patient could be a different color, but you could do whatever you want. Just be careful if you leave these on there. This is a really nice pen. Somebody might just take it. I also have deodorant. It gets hot. It gets really hot. Now that we are in this pandemic, you're going to be in PPE, like extreme PPE. So you're gonna get hot, you're gonna be in the room, you're gonna be, you know, you might be changing your patient, you might be positioning them, you might be helping them walk, you might be bathing them. You're gonna be in that PPE and you're gonna be sweating. It's gonna be hot, the rooms are warm, and you're gonna be on the go constantly. You don't wanna be that smelly nursing student. I don't think anybody wants to be, so just carry deodorant. I would stay away from body mist, perfume, cologne. Your patient could be allergic to that. Your patient could be sensitive to smell, and you just don't wanna make their stay at the hospital worse. You know, they're already there because, you know, they need some help, and you just don't want to make their stay uncomfortable. Also, some hand sanitizer. When I carry my hand sanitizer, it's usually when I have my sweater on. Now going into the hospitals, I don't know how it's going to be like with the pandemic. You're in a hospital, so you're gonna be surrounded by hand sanitizer, obviously. But you know, sometimes you wanna have this on you, like when you go for lunch, you might not have the opportunity to, you know, just get hand sanitizer anywhere. I know that it's different now. I'm sure that hospitals are making sure that their employees, their staff members are, you know, they're safe and they're being precautious and they're having this everywhere, but I just like to carry my own. You never know when you're in the time of need for hand sanitizer and there's none available. Also, a coffee mug. I usually stop at like Starbucks or Dunkin' or something to pick up iced coffee or something, but sometimes, you know, you're just on the go. Maybe you're running late, you woke up late, something happened, there's a snowstorm, and you don't think that you're gonna be able to stop. Have a coffee mug. This is beautiful and big, and it has my name. I will definitely be taking this to clinical. A lot of coffee. It's gonna be great for my 12-hour clinical in the ICU, so I will be using that. And then you need your stethoscope. I know that they might have one-time use, not one-time use, but like the stethoscopes that they have on the floors to use for a patient who has a type of a contact precaution on their room. But I like to have mine just in case. I always carry mine. You never know. What if you have a patient who has, I don't know, CHF or something, and your nurse is like, this is the time for you to apply what you have learned, go ahead and assess the patient and listen to their heart, listen to their lungs, and you don't have this on you, and then you just miss out on an opportunity. So make sure that you always have this on you. Take it to clinical. You know, that's the place to learn. So carry everything that's going to help you apply what you're learning in lecture. My glasses. So my glasses is something that I'm going to be taking. I do have contacts now. I just purchased my first pair of contacts. So far, it's going pretty good, but I want to carry my glasses because, like I said, it's my first time using them. I don't know how it's going to be, what it's going to be like wearing them at clinical. I don't know how I'm going to feel, if they're going to be too dry, if I'm going to be uncomfortable, what if one pops out. You always want to be prepared. So I'm going to take my glasses just in case, you know, rather be safe than sorry. I'm going to take my student ID. You always want to have your student ID on you. Remember, you're representing your schools when you go to clinical. When you go anywhere, you're representing your school, so you always want to make sure that you have your ID. God forbid something happens and they need to contact your institute or somebody, your clinical instructor. If you don't have that on you, how are they going to know who you are, what you came from? You know, obviously you're going to have a hospital ID badge, but always have your school ID on you because that's important. And I know that your nursing school is going to, you know, stress it, like you have to have that on you all the time, no matter what. Another thing that you're gonna need is your mask. This is the N95 mask that was given to me by the hospital that I will be having my OB clinical rotation. Always have a mask on you. I would suggest for you to have a disposable mask. That's just something that our job, I mean, my job, I work at a hospital, and that's just something that they suggest because it's more sanitary. When you're constantly going in and out of your patient's room, and like you've had like a long day and you're going in and out of the room, the masks get dirty. And if you have the reusable ones, are you sure that you're going to be washing them every day like the cloth ones? You're better off wearing one that's disposable. It's not only more safe for you, but it's more safe for those around you that live in your household, your friends, your family, your loved ones. And I just think that it's part of hospital policies too, to wear the disposable ones rather than the ones that are reusable. Something else that I carry is like pads, tampons, tissue. You know, you need to have that on you just in case. You don't want to be that person that like arrives to clinical and is not prepared for like a situation like this, and you have to leave because, you know, you weren't prepared. Always have that with you. Something else that I carry is medication. If you're going to take medication to clinical, make sure that you talk to your instructor and your school, and you make sure that you verify that that is okay, because sometimes they don't allow that. I do take sometimes medication, but I make sure that it's from the original bottle. You don't want to take something in a plastic bag because that could look suspicious, and just don't do that. Just don't risk getting in trouble. Tissue, gum. I think that you should always have like snacks on you, like easy grab and go snacks, like Goldfish, Cheez-Its, fruit snacks, a granola bar. I carry gum on me, just something quick, you know, because what if your patient is going down to receive dialysis, or they're going to the OR to get surgery, and your nurse is like, hey, do you want to join them? And your clinical group is headed to lunch. You can easily just stuff your face with a snack, prepare yourself to follow your patient, and go get that learning experience. So you just want to have something that's really easy and easy to eat. Something else that I carry in my clinical bag that I just don't have on me at the moment is my sweater. So I don't know how it's going to be now with COVID-19, but my school, you know, they have the pants and the shirt with the logo, our school's logo, and we have sweaters. We have sweaters. I don't know what material they are, but they're the type of sweaters where, like, if you were to spill something on them, let's say your patient spills something on you, vomits on you, urinates on you. I hope that doesn't happen to anyone ever, but I'm sure it does happen. It doesn't absorb it. It like kind of just like rolls off. I don't know the term for that type of material, sorry, but I carry a sweater on me. I don't know if I can this upcoming semester, but I will be carrying it if I am allowed to, because it gets cold sometimes. But if you're constantly on the go, you're most likely always hot. Let's see. I forgot this. I think I left it upstairs. Something that I would suggest for the incoming nursing students is your drug book. I don't know if you will be able to access it right there and then when you are, you know, shadowing your nurse or going about your clinical day, but having your drug book is so important, because let's say you have a patient that is on some medications that you don't know, you're not familiar with, you've never heard of them, but you want to know what they do. Easily, when you have a chance to like take a break with your clinical group, you could pull out your drug book and you could write that drug down on a sheet of paper and look up that drug when you have a chance to do that on break. So I would really suggest for you to carry your drug book, because you're learning more and you're getting that learning experience that they want you to get at clinical. All right, well, that's my video. I hope that it was helpful. I hope that you learned something from it. Remember just to go into clinical with, you know, with the optimistic mindset. You're there to learn. If you do have the privilege to head to in-person clinical and you're at a hospital, make the best out of it. That's where you're gonna learn the most. I feel like a lot of the situations that I've had in clinical have helped me learn things better. And I feel like that goes for anybody. When you apply it in an actual nursing setting, that's where you're gonna learn it, and that's where you're gonna be able to apply it and, you know, gain the most knowledge from that. So, you know, go out there and learn, be safe, make sure that you're following hospital policies, you are representing your school when you go to your clinical rotation, so be at your best behavior. Always ask questions if you have questions. No question's a silly question. Believe me, I ask so many questions, even if it's something that I already know the answer to. It doesn't hurt to you know, to just get that clarified for you, because then it's gonna stick. And have fun, I guess. This is great. If you're heading into clinical for the first time, you're gonna have a great time. You're gonna learn a lot, and then you get to see what you like and what you would consider when you graduate and pass that NCLEX, so what kind of a field of nursing you would consider going into. I hope that everybody's safe and has a great day. Make sure that you give this a like and a thumbs up, or I think that's the same thing. Yeah, and you subscribe to the channel. Thank you so much.